My name is Ken Kernen. I've been a urologist over 20 years, and I'm a partner and co-director of research at the Michigan Institute of Urology. The first time I heard about iTind, I was actually very excited about it. I thought, hey, here's a new great minimally invasive device which is not permanently implanted, has little or no sexual side effects, and great durability and tolerability. There's a great step between medicine and major surgery, or even a great step like the iTind that doesn't require any medicine at all. So BPH stands for benign prostatic hyperplasia. 60% of all men at age 60 and 80% of all men at age 80 have BPH. It really presents with symptoms of a slowing of the urinary stream, nocturia or getting up at night. You can have urgency and frequency of urination, and you can even have urinary incontinence or leaking of urine. One of the most common reasons patients come and talk to us about their BPH is nocturia or getting up at night. It really probably is one of the most bothersome things that they have happen in their lives. They get prompted by their spouses because if they're getting up 2 to 3 times at night, normally it's bothering their spouses. And sometimes it's actually the spouse that tells them to come in and see a doctor. One of the things that's really important is patient education and to get the word out that, hey, this is not necessarily normal, you don't have to live with it, and there's great minimally invasive therapies that can help you get better. So the iTind is a temporary implantable device for the treatment of BPH. It basically requires either a small rigid or flexible cystoscope to implant. The device then remains in the patient for approximately 5 to 7 days, and then they come back to the office where it's removed using a silicone catheter or a ureteral access sheath. So the way the iTind works is it's a temporary implantable device. It has 3 struts made out of nitinol. Those struts actually exert pressure over time at the 12 o'clock, 5 o'clock, and 7 o'clock position, really causing ischemic necrosis, and that's really what opens up the prostate and bladder neck. One of the advantages of the iTind is not only can be placed through a large rigid cystoscope, but you can also use a small rigid cystoscope or even a flexible cystoscope, which may be more comfortable for the patient. One of the great things about iTind and really makes it unique is it's a temporary implanted device. Most patients do not need a catheter at all. In fact, the catheterization rate is less than 5%. And one of the things that patients really worry about is sexual side effects, which fortunately the iTind has no sexual side effects when it comes to either erectile dysfunction or retrograde ejaculation. The other thing that patients don't want to have is a large rigid cystoscope. So with the iTind device, it can be placed either through a small rigid cystoscope or even better, can be placed using a flexible cystoscope. And the iTind device is really the only minimally invasive surgical therapy that can treat both a high bladder neck and BPH at the same time. Most patients don't want to have anything permanently left in them, and that's what makes the iTind device so great. It's a temporary implanted device which lasts for approximately 5 to 7 days. So one of the things to tell my colleagues out there who are urologists is this is something that all of us can and should be doing. I think this is a perfect fit for those patients who don't want to be on continued medication, don't want to have a permanent device, also have symptoms that are really bothersome. And again, the advantage is minimal side effect profile, no sexual side effects, no requirement of a catheterization. I think the take-home message is BPH is a normal thing that happens to most men as we get older. You're not alone, you don't have to live with it, you don't have to rearrange your whole life to deal with the bothersome symptoms. Go see your urologist and talk to them about how to get better.